Hi, everyone. This is Sheryl. This is Clientele, and I have got somebody so extraordinary sitting next to me. I'm so excited to have him. I know I say that every week, but I really am very excited because he's so inspirational and so encouraging, and he's got so much to share with you. I want to introduce to you a premier dentist, and not only that, but a great humanitarian. Wait till you hear his story. Dr. Arun K. Garg. Can you say hi to our viewers?
Hello. How's everyone?
I wish they could all answer you. I'm so blessed and honored, Dr. Garg. We have so much to talk about, and I'd love to find out, because I talked about humanitarian. I really want to emphasize that, in addition to the fact that you are a world-renowned dentist with clinics in Florida,
Yes.
your brand new one in Arizona, in
Yes.
Phoenix, and I want to talk about the Dominican Republic. So how did all of this start?
You know, I was a full-time professor at the University of Miami, and for nearly 20 years, for 18 years to be exact. So after I did my undergraduate in chemical engineering, then my dental school training, and then my residency training, and then I went into joining the faculty at the University of Miami. At the University of Miami, there's no medical school. There is a medical school. There's no dental school. And within that medical school, there's the normal departments: Department of Obstetrics, Department of Orthopedics, Department of Surgery. And within the Department of Surgery was a number of divisions: and Division of Plastic Surgery, and Division of Heart Surgery, and Division of Oral Maxillofacial Surgery. And we were part of that division. And there we invented a lot of techniques, and we trained residents, is not dental students, but residents that were doing postdoctoral training, is published a lot of articles, published a lot of books, got to travel all over the world, is training folks, is in a lot of the work that we did and a lot of the things that we invented. And that was the genesis of all of this. And my passion has focused initially on dental implants and bone grafting. And those are my two big passions, is taking those folks that have lost bone because of gum disease, a lost bone because of accidents, a lost bone because of cancers, and regrowing their jawbones, and then taking those jawbones, and if they've lost not just the bone but the teeth, is reimplanting the teeth via dental implants. So that's been my passion, is for my entire career, that near 20 years as academic career as a full-time professor at the University of Miami Med School. And then during that time, what would happen is some folks would say, wow, that's great. My jawbone got regrown and formed. And wow, that's even more fantastic. You're able to put dental implants in, which is titanium screws in essence. You know, this is a tooth. That's the part that you and I see, but that's only 1/3 of the tooth. 2/3 you don't see. It's actually in the bone and gums. And so the tooth actually 3 times as long as what you see in the mouth, approximately. And when it's taken out, is when God does it as one piece. When we put it in as 3 pieces. The screw goes in, the root goes in, the body grows the bone up to it and bonds to it. That takes about 6 months. And then after that, the crown is made, the part you see in the mouth, and there's a connector called the abutment that connects it. So it's 3 pieces. And folks were delighted. They were able to get their bone back and able to get their smiles back and their teeth back and functioning. And those dental implants, they function just like your own teeth. They're actually stronger than your own teeth. You know, is any dentist in the country can take out a healthy teeth if it needed to be taken out for some reason in about 20 or 30 minutes. There's no dentist in the country that can remove a healthy implant. It is that strong. It is impossible to take out. And they're delighted. But then what would happen is I would say, well, I've got this great bone again. I've got these great teeth again, but I got wrinkles here. And I've got these grooves that I didn't used to have. And my skin and lips around it. So it's like having a beautiful picture, but without a beautiful picture frame. And so that's when my interest grew and said, well, let me finish the treatment. Let me look into what types of things we can do, whether it be dermal fillers, whether it be skincare products, whether it be Botox, whether it be healthier living to give better skin, whether it be nutrition and supplements for all this. So we started looking into that and advising our patients on all of those is things in conjunction with bone, in conjunction with dental implants, is health. The skin is a better frame around it, and that's how it evolved. And then after my 20-year academic full-time career, I've been now in private practice for the last 10 years and continue to do the same things. Academically, I taught full-time residents that were at the hospital and I went around the country, around the world on a weekly basis back then is training folks. And I continue to do that to this day. I travel on a weekly basis. I get on a plane literally every single week, and sometimes 2 or 3 cities each week to train is dentists to provide better care for their patients, to provide better bone growth, to provide dental implants, and to provide better skin is a better frame is around the picture on a regular basis. So that's how all of this is started.
Dr. Garg, what just blows me away is the fact that you are able to restore people's smiles. Now, I'm not just talking about aesthetically, because that's number one, that's what you do. But I'm talking about inside, that they finally look at themselves in the mirror, those who have had horrible bone loss and spaces in between the teeth, or just terrible teeth their whole life, and have wanted somebody as expert as you and the dentist that you train to do this work, to be able to look in the mirror and say, oh my gosh, thank you, God, I can smile again. That's awesome. So I love that you do that.
Thanks. It's life changing. Is a lot of dentists do fillings and crowns and root canals, and there's a lot of value in that, absolutely. But it may not be life changing dentistry. But this, when you can get them their smile back like that, when they're missing every other tooth in their head, is either because of fear of going to the dentist or lack of monies or so much bone loss that there's lack of expertise around to address it. And those are the most common reasons. And to be able to take that person who, because of missing every other tooth in his head, can't find the right boyfriend or girlfriend or mate for life or the best job that they potentially could have, and lose out on all of those opportunities. And you can restore that for them. We can change that and give them a smile and get them the jobs and the promotions that they know they deserve. Is get them is a boyfriend or girlfriend or husband or wife. That's really life changing. It is not just a filling.
It is. It's miracle work, and that is exactly what you're doing. You are helping to create miracles in people's lives, and I love that about you. And I want to talk about, speaking of that, let's talk about not only your clinics in Florida and your clinic in Arizona, your brand new one that you literally just opened in Phoenix. I'd love our audience, Dr. Garg, to know about the Dominican Republic. Could you tell us a little bit about that?
Of course. I've got 4 offices throughout South Florida, Fort Lauderdale, Miami. Most recently just opened in Phoenix, Arizona, which is where I'm at today, as a matter of fact. And then we have 2 offices in Dominican Republic. Those are very different. All of these are traditional offices. Dominican Republic I set up is purely for charity reasons. And I picked Dominican Republic. It's close to me from Miami. It's a 1 hour and 42-minute flight. And I've had a lot of Dominican employees because Miami is close, and a lot of folks that have worked there. And I liked those folks, and said, hey, we should do outreach programs. And I've always, the way my parents have raised me, we've always tried to give back in whatever way as we could. I mean, when we had no money, we still donated a percentage of no money. And as we got a little money, we still donated a percentage of it. And as we got more, we still donated a percentage of it. And but I thought, instead of donating other causes, we should be the guys that make a cause. And the skill set or the gift set that I have been given in this life is through dentistry and dental implants and growing bone. And so that's what we decided to do. We opened a very, very large clinic there. It's 30 dental chairs, a 3-story building, freestanding. And we did it from scratch. I went down there, we got the building, we designed it as we architects, did internal thing, shipped all American is CAT scan machines and American implant motors, et cetera, and then just started offering free dental care to the local community. We hired folks. I hired full-time 14 dentists here, 35 team members, so 50 employees in total that I personally fund completely without fundraisers and such. And we treat 200 patients a day at complete charge is there. And each year do over $50 million of free care a year is there. And frequently end up on the news on a monthly basis, newspapers and television and radio and et cetera, because of the humanitarian work that we do. And we're not doing it for that reason. The most important thing is to be able to help these folks, to be able to get jobs, to be able to get his mates, et cetera, is to be able to have dignity is to do it for that. But the amount of thanks and gratitude we get from these folks is immeasurable. It's just incredible is what happens. And actually is that's kind of was a genesis of opening this clinic in Phoenix. We said my Miami clinics, they work very, very well and they make nice profits and such is for me. We said, Phoenix, let's replicate what we have in Dominican Republic. Let's create here the same type of thing where we can provide care is and provide it at no cost, or some care at no cost, some care at low cost. And so that's what we've done here. We've launched this clinic here. It's intended for is mainly we're focusing on American vets. And but if there's slots available and someone is not a vet and they'd like to get one of those spots and they're a little down on luck or don't have so much money or just regular folks, I don't want to call this a clinic for poor people. It's for people. We're not here to help poor people. We're here to help people.
Yes.
You can be poor or rich or middle class, whatever. And you just say, hey, I'd like a little break on this. It's great. We can do those things for you. And this is 10 chairs here. Is 10 dental operatories, CAT scan machines. The latest equipment is the best care. And so we're doing that as well. And we're on track this year is 2021 is to do $5 million of free care to vets and others is in the local community here. And I'd like to do this in other places. Why can't we do this for folks in Las Vegas in the future? And why can't we do this for folks in other cities around America? And that's the future plans.
So it's just amazing the work you do. And then how many dentists? You've trained over 3,000 dentists, is that correct?
We train over 1,000 a year. So we've trained 3,000 last 3 years, but I've been doing this now for 20 years. So if you just look in the recent past history, yes, 3,000. If you look in since my start on training as dentist, is 20,000 dentists we've trained.
Well, we're going to get into clientele and MDR in a minute because I wanted to cover that, but that's amazing. 1,000 dentists a year over a 20-year period. You talked about fillers. Now, this is a question that always comes up. But Dr. Garg, what are the things that you and I were talking about in regard to having cosmetic procedure? If you're going to have it, what do you have to do to maintain it?
Well, the main thing is a lot of people think of whether it's a procedure or whether it's skincare as a vanity thing, as a cosmetic thing. And in my mind, that's a very, very small fraction of it, because if that's the only reason you're doing it, you can't maintain those results. More than just the vanity aspect is in order to get that glow, in order to get that skin, in order to get that is regeneration and the younger skin coming from underneath, you've got to have good nutrition. You've got to have good vitamins and good supplements. You got to get the right amount of sleep. You got to not be drinking too much alcohol. You got to be not smoking too much. It's all of those things. It's a healthy lifestyle. And that's what's going to give you the best skin. That's what's going to give you the best is care. And that's what's going to maintain it. And so just to do one aspect of it, just to get a filler or just to get a Botox or just do skincare things and skip is nutrition and supplements and sleep and is eating right and is not smoking too much and not is drinking too much, is you can't maintain long term. Well,
this is what we talk about all the time in our interviews, that It's all coming from the inside. You've got to, as I
Yes.
said before, and you're saying right now, as the doctor, you've got to
Right.
supplement. If you're going to have these things done, you want to maintain the results of it. So you can't just go in and have it done and not do great skincare, not do great supplementation. So you're going to be teaching dentists, if
Yes.
you've not been doing it already, to do fillers, because as you said, once the teeth go in and once
Yes.
the jawbone is grown back again and everybody has their gorgeous smile, they're noticing, uh-oh, you know, with the foundation of the teeth and the jawbone, that's great, but I've got to make some changes. So you're going to be teaching dentists to do that, correct?
Yes, and we have been, as you said, is what happens is over time, you know, right here, this used to be flat for each of us. And over time, we lose some fat here, and this becomes a groove here. Is here, it used to be flat. As we're younger, as we're older, we get a groove here. These areas is used to have is more collagen there. So you're sitting there just resting, you're texting, it looks like you're smiling. As we get older, you're resting, you're texting, it looks like you're frowning. And you're not
Yes,
meaning to be frowning, it just looks like that when you're resting,
true.
right? And you see people say, you know, they call it, you know, their B face, you know, and it's not resting like that, it's just a loss. And so if we can plump this back up, if we can plump this back up, if we can plump this back up, is it used to be we've got collagen here, and what happens? You lose that collagen, it droops. You don't have those high cheekbones anymore, and it's not high cheekbones necessarily. It's the collagen on top of those high cheekbones. Is we lose that collagen in here, and all of a sudden you see the dark circles under eyes, and all of a
That's
sudden they look
right.
more sunken in. And if we can fill those up, we don't get those dark circles. It doesn't look sunken in anymore. So that can be done with what's called fillers. And fillers have been different types. And what happened is the first type of fillers that were used were things like hydroxyapatite mineral, the same mineral that bone and teeth are made up of. And they would inject those and they would be there forever. And all of a sudden, things would look lumpy and bumpy. And so they didn't do very well. They had fillers made of acrylic materials, is polymethyl methacrylate. And then over time, that would look lumpy and bumpy. You'd have these beads in there. And eventually, they got to fillers made of materials that is hyaluronic acid. Hyaluronic acid is like a sponge. It naturally occurs in our bodies, and it holds 1,000 times its weight in water. And so it's a natural occurring product, is placed there. It absorbs more water, and they can plump things up. And so that's what's used is most often today. We've actually taken that a step further. Is my research was on what's called platelet-rich plasma, PRP, and Robert Marks, also at the university, is he and I pioneered is PRP, and we pioneered it for its effect on bone growth. But we found out that it has so many other applications besides bone growth. It helps with soft tissue growth. And so what PRP is, you draw a test tube of blood from the patient, you spin it, the red blood cells go to the bottom, the platelets go to the middle, the serum goes to the top. The middle part, the platelets have growth factors in them. And by taking just the middle part, you've concentrated the platelets and hence concentrated the growth factors. And we would add that middle portion to our bone graft. And what we found is the bone matured twice as fast and became twice as dense when we did our big bone grafts. We later found that the skin tissues and gum tissues matured twice as fast. Well, then we started thinking sort of really outside the box even further. We said, what about if we use this to inject in as our fillers? Nothing foreign at all, drawn from the patient, their own blood, a test tube of blood, spinning it, taking the middle layer, and re-injecting it into the face. That won't just be a filler. That won't just be hyaluronic acid absorbing water. Those growth factors will actually reform their collagen. It will address the underlying problem. And that's exactly what it does. So we talk about as fillers, but made from the patient's own blood, a small amount of blood. It's a test tube, 2% of what you would give in a normal blood donation. It's a very, very small fraction, what you give in a normal blood donation. Making the filler out of that, placing that, and not just a temporary fix, actually regenerating the collagen that's been lost. And on a cost perspective, is what happens is now you've got something completely natural, completely biologic, and the cost is negligible cost on that.
Well, and I was going to speak to your point a couple times, but I wanted you to complete it.
Absolutely.
What we believe in, again, clientele, because our founder, as you know, is a biochemist with her background in nutrition. Yes. We believe in, if you're again going to do any of these procedures, now that sounds pretty extraordinary, right. Very different than most. But if you're going to do any of these procedures, you must maintain it. You're spending money on this. You must maintain it because it doesn't last forever.
Yes.
With phenomenal skincare. So let's talk about what happened to you, because you were willing to take this journey with me.
Absolutely.
And try our skincare and try our nutrients, knowing everything that you do. So what did you tell me in the first day or two that you used clientele?
You know, the thing is, I try, whether it's bone graft materials, I try all of them. Whether it's dental implants, I try all of them. Whether it's skincare things, I try all of them. And I've never done this type of feedback before. And I never have, because I don't work with companies per se on anything. Is this time is I was eager to, and I was delighted to, is because from all of the different things that I've tried over the years, and I try everything so I can give good feedback to my doctors when I train them. So when they ask me what is the best bone graft material, I can advise them. What is the best suture material, I can advise them. What is the best dental implant, I can advise them. What is the best skincare products, I can advise them. And that's why I try everything, is hands down the best out of anything I have ever tried is out there. And I've tried pretty much everything. The results were within a day. I mean, as you know, because you've been working with these products for so long, is I saw results within a day. And I don't know which aspect I saw it from. I suspect it was probably just from the cleanser. I mean, I think just the cleanser alone is would have shown the results. And you take the cleanser, and then on top of it, the other products, and then on top of it is the supplements. The supplements, I don't think led to the immediate one-day results. That's what I started probably seeing 2 or 3 weeks later. But I saw results immediately within a day.
And you were, and this is funny, everybody, because that's what Dr. Garg told me. He said, can this be happening? He said, I've got a 10 times magnification mirror, and I keep looking at it. And can this be really happening? Because I've seen it in one day. So we're talking to a man who specializes in dental implants and changing the scope of the way a person looks and feels once they get to look in the mirror, and who is willing to take his own body and give it to us for a few weeks and do this journey with us with clientele. And he's telling you that it's amazing beyond anything he's ever tried. So I am very excited about that. And I've got to tell you, Dr. Garg, we hear it every day, but it's fantastic
you must,
to hear it from you. It's
well, you know,
to hear it from you.
Being a scientist and being a researcher and being a doctor, I mean, I had to ask myself, I mean, is it psychosomatic? Is it something I just convincing myself? And then the second day and the third day. So here's what happened. Is this way I knew it wasn't psychosomatic. I had not told any of my team members, any of my employees, that I was, trying this or something different or new than I've tried before. And I can tell you, by the second and third day, 90% of my employees that I ran into asked me, what are you doing? You look different. And I said, different how? Better or worse? Okay. And I said, no, much better. Something about your skin, something about your face. You have this glow, you have this radiance. Your pores look tighter. Your skin looks better. Is 90% without any prompting from me. And that's when I knew it's not psychosomatic, because they had no idea. Is they weren't trying to flatter me or anything, because I hadn't told any of them this. That's when I knew it was real.
Well, thank you. And I want to say, everybody, please like and share this, because first of all, the information that you just received from Dr. Garg, just all about what he does for, your new smile, your new outlook on life, your life-changing situation. We definitely want you to find him. That's number one. So we're going to give you all of that information in just a minute, but like and share this information, because Dr. Garg, one of the things we actually do is we like to give back to you. So we are giving $150 to somebody that does like and share that we're going to draw next week, and we'll announce that. We do that every time. But
Okay.
I want to talk about exactly what you're doing. So I'm going to give everybody a little rundown. Now, here again is a man. We don't have a lot of men that come on the show, not yet, but we are going to. We just had a great gentleman, Ben Starling, he was just on. But I want to show you, everyone, women and men, that men love clientele. There's no such thing as a men's line. I know it's marketed that way, but there's no such thing. So men love clientele. Look at the great results that Dr. Garg is talking about. And he said, just from the cleanser alone, the Lotus Renewal Wash, this is an alpha and beta hydroxy acid cleanser. So it's doing, Dr. Garg, a microscopic peel. And it's getting rid of, I'm sorry, say it again, please.
No, exactly. That's exactly right.
Yes. So you would have to look through a microscope to see it being done. You'll see the results of it. So it's getting rid of all the can't even speak, aged dead skin cells, cleaning the pores, brightening the skin, because once you get rid of the old dead skin, there's your brand new healthy cells. So your skin is bright, your pores are refined. So this is what he's doing. And I made it really simple for him. We had a personal consultation. We talked all about everything Dr. Garg talked about. You talked about lifestyle. What do you eat? How do you sleep? Do you exercise? Do you drink? Do you smoke? Do you take medication? All these things are essential to know. Not just, is your skin oily? Is your skin dry? We need to know everything about you, just like Dr. Garg does when he is giving you an analysis and deciding what your treatment is going to be. So that's number one, is we got rid of dead skin. Then how did you like, Dr. Garg, your serum, your Lotus firming serum that went on right after?
Is this, I saw immediate result just from cleanser. I put the serum on, and then what you told me, the third step and the fourth step, and I took notes, and I just lined everything up, step 1, step 2, step 3, step 4, on the cabinet there, and just followed it in sequence. It felt great. I started again seeing results within 2-3 days with these products. I liked it so much. I believed in it so much. I actually asked my teenage son, who's just graduated from college, and he's got a job and he's working, and I wanted him to get started with this. And I've never ever referred a product to him, or endorsed a product to him, or recommended a product. I mean, that's not the kind of conversation I have with my teenage son. And for the first time ever, I wanted him to get involved and start using these products.
And that's a huge compliment. So the Lotus firming serum is something we can tell Nathan, I know his son's name because I've spoken to him, is actually a DNA repairing enzyme. It is the most intense concentration of lotus seed, and it is absolutely proven to resist and defy the aging process, and clientele is the only one that has it. So if you're going to go to Dr. Garg's clinic and you're going to get bone regrown and you're going to get implants, and then you are looking to, if he's going to do any type of PRP on you, you're going to want to maintain this and make sure that your skin cells do not misshape into lines, into deep lines, wrinkles, loss of elasticity. We're talking about collagen, elastin, hyaluronic acid. And in our product, Dr. Garg, we use hyaluronate. So it's a smaller molecule for absorption. So you know all about that. And then you're doing an environmental protector during the day to put on your skin to protect you from the pollutants and the sun. And that is your peptide hydration. This is also a microscopic peel, as it's providing the hyaluronate for you. So you're getting rid of dead skin, and you're able to absorb your serums and your moisturizers and do this all in one. And then tell us about your vital factors. The first day you, product overboard. The first day you drank your vital factors, what did you feel?
I felt more energy. I was able to, I've got an app on my cell phone now, a sleep app, and I found my sleep cycle got better. is more restful sleep, is about the same amount of time, but just a better quality of it. And it showed that. And so I use that. I started using the supplements along with it. Is I started seeing the results after several weeks. Is feeling better, and and I think looking better as well.
Well, I have to say again, thank you. Thank you for this, because the vital factors, this is going to very much tie in, Dr. Garg, to what you do, because this is actually promoting your own HGH, your own human growth hormone that slows down as we age dramatically with every few years. We start noticing memory lack, loss of focus, bones and joints getting little aches and pains, loss of elasticity, so the laxity of the skin all over, and your cardiovascular health, your immune health, your metabolic health, all of that ties in with what you do. And that's why you felt that jolt of energy. It's not like an energy drink, but it's something that actually allowed you to work an entire day and still feel good.
Right.
And Dr. Garg, the men's fitness tabs. Now, you said you're starting to notice changes over weeks with your nutrients. What did you start to notice with the men's fitness tabs? Did something change based on the other supplements that you used to take?
You know, I think that's what it is as I just said earlier, is better sleep and more restful sleep, is feeling better throughout the day. And I've always taken, normal vitamins and supplements and vitamin C and, sort of the whole is, et cetera. But these that were designed specifically for skin, these that are designed specifically for energy, these that are designed specifically with the growth hormones is, or the precursors to growth hormones, is helped on the things that I wasn't getting from my sort of one a day kind of vitamins.
Well, I thank you again for that, because you just look like the picture of health. Now, when I saw a picture of you, I thought you already looked great, and I told you. But you do. You look fantastic. And with all the traveling you do, doctor, it's so imperative that you keep your strength up,
Yes.
your stamina, because you've got a schedule that is crazy, but I know you love it.
Yes.
And with all your plane travel and staying in different places. Now, I know that you actually have a place in Arizona. You've got, of course, your home in Florida. I don't know if you have a place in the Dominican Republic,
I do, yes.
Okay, but you're roaming around from here to there to do all this incredible.
But the other cities I go to, this weekend I'm going to be in Los Angeles, and I go to San Francisco and Seattle and Chicago and Dallas and North Carolina and Boston. I don't have homes in those places, so I'm in hotels. Probably twice a week, so I probably average 100 to 150 nights a year in hotel rooms, and with the traveling. And so that's why, for me especially, it's critical to keep my health up. But for everyone, whether that kind of schedule with the travel, or that kind of schedule with the work, or that kind of schedule with the family, is irrespective. It's still a busy schedule. You still need your energy. You still got to peak performance is what you need. Is irrespective whether you have this kind of crazy travel schedule or not. Is everyone's got a busy life. And so the important thing is to have your best performance in whatever you're doing in your life.
That's right. And one of the last things that I'm going to mention that I gave you based on that was the On Guard, because this is a blend. It's a proprietary blend to really build your immune system. This is On Guard Immune Defense. And if you, Dr. Garg, let's say you were traveling, for some reason you got a little sore throat. Well, nowadays when we get a sore throat, we don't go, oh, it's a sore throat, it'll go away. Nowadays we go, uh-oh, we're concerned because of the virus.
Right.
So this is something that you would take not only twice a day normally, but if that happened, you would do what's called a load in, and you take 4 of these every 6 hours, and boom, watch your symptoms in a couple of days. It's amazing. So I want you to do that, Dr. Garg, if you're ever feeling that you're getting something.
Yeah,
but
I brought it out on the trip with me. Fortunately I haven't needed that load in yet, but I've got the protocol that you gave me on it.
Yes,
I'm ready in case.
And prayerfully you won't. So
Yes.
Let's find out, because we're going to say goodbye to everybody in 1 second. I'm going to first say, everybody like and share, like and follow, call us at clientele at 800-327-4660, 800-327-4660. If you want to speak to me, Sheryl, extension 5709. But I'm also going to announce our winner in a moment. Most importantly, Dr. Garg, how does everybody get in touch with you for this wonderful work that you do?
I guess the easiest thing is www.gargdmd.com. And that's just the addresses of my 4 Miami clinics. And if they had an interest in that, would have that listed there. If they had interest in our foundation programs in Dominican Republic or here in Phoenix, they can speak with any of my team members there and get access to any of those locations or to me. And my team members will, as always, to share my cell number, my direct email address with anyone and everyone that wants it.
That's wonderful. We're going to have that also in the comments. And by the way, everybody, if you've got questions for Dr. Garg, put them in the comments and I will make sure that those questions are answered. I know he's got, as I said, a busy schedule, and he told you what his schedule is, but he's got a heart for the people. So if you've got questions about your mouth, whatever it is, the PRP that he talked about, his love of clientele, how it's helped him, the nutrients from MDR, how it's helped him, he's got answers, and we've got answers for clientele. We're going to announce our winner for last week's drawing, and it is Shelly Mann. Shelly Mann, I'm going to say congratulations. You've won $150 worth of clientele and MDR, maybe some of the things that Dr. Garg and I are talking about. But Dr. Garg, what would you like to say to everybody to encourage them and inspire them to take good care of themselves? I'm going to let you take us out here.
No, thank you so much. What I would say is keep living your best life, is keep focusing on being the best that you can. And in any way that I or Sheryl can help you, we're here for you.
Thank you. What a phenomenal, phenomenal man. I just believe that when you go to the clinics and you have that personal attention from Dr. Garg or any one of his team, I can imagine your team is phenomenal because you've trained them.
They are.
You are going to get the best treatment. You're going to walk out of there going, wow, where has this man been? Why haven't I found him before? And you're going to recommend your brother, sister, mother, aunt, uncle, and friends and everybody else, because he's very special. You don't want to miss this man. So I'm going to say thank you, Dr. Garg. Again, I'm so blessed and honored that you took the time on this journey with us for clientele and MDR and took the time to spend with us on this interview today. And I'm going to say bye to everyone and to join us next week when we have another very amazing guest. I'm not even going to tell you who it is. You're going to have to tune in. So we're actually going to see you Saturdays now, 1 p.m. Eastern Standard Time. Central Standard Time is 11 a.m. Pacific Standard Time is 10 a.m. And I don't want to forget Mountain Standard Time. That is 11 a.m. I hope I didn't get all of these times wrong because it's a new day and time. But 1 p.m. Eastern Standard Time, I think you can figure it out from there. Visit Dr. Garg in Florida, in Arizona, in the Dominican Republic. He wants to see you. Have a great, great rest of your week, everybody, and be blessed. Can we say bye, Dr. Garg?
Great. Thank you.